Hello and welcome everybody. Dr. Alberto Panero here. I have the pleasure of speaking with Annette Ambach. She's a MD, a physician that I've been working with closely for several years. Recently started her own practice, BioEvolve. We're going to chat a little bit about that and get to hear all the cool things that you're doing. Today the topic is really going to be spine related, so biohacking the spine. How do we do it with orthobiologics? We should probably note that all the stuff that we're talking about today is off-label, right?
Correct.
And we're not insinuating any indication. It's really just for educational purposes. So welcome. Thank you so much for being here.
Thank you for having me.
It's such an honor and pleasure. What type of biologic do you like to use? PRP, bone marrow, micronized adipose? What's kind of your go-to?
Yeah. So there's not enough studies on adipose at the moment with regards to discs.
Sure.
There's one study on using SVF, but we can't do that currently in the country. Majority of the studies are on PRP and bone marrow concentrate.
Yep.
So I started my practice when I was doing the trials with predominantly just doing bone marrow concentrate.
Okay.
And then we published that RCT with Anu Navani, comparing PRP and bone marrow concentrate, and it was only a 1-year follow-up, but our results were similar.
Sure.
With PRP and bone marrow concentrate. And then Greg Lutz came out with really high concentration PRP, really good outcomes, and then other data were coming out with regards to discitis with intradiscal bone marrow.
Got it.
So that's kind of when I started switching. Hey, maybe I should, consider switching and see what the results were.
Sure.
The initial results that I was seeing, comparing the two, was that bone marrow concentrate, they do get results right away.
Yeah.
Like quicker resolution of that low back pain, usually within the first 3 to 4 weeks.
Got it. Okay.
PRP just takes a longer time for me, especially if you really want to concentrate your PRP.
Yeah.
So you do have some of that WBC in there.
Sure.
It does flare them up a little bit.
Right.
Now, if you use more of the anti-inflammatory PRP, there's plus and minuses to that. Then you do get that improvement of the symptoms initial, kind of quicker too.
Yeah.
But majority of the time, it takes a longer time for me to get that response to the PRP.
Okay. What in terms of fluoroscopy versus ultrasound guidance? How do you perform the procedure? What's your go-to?
I was trained with fluoro in the intradiscal.
Okay.
I feel that that's still the standard of care, especially with intradiscal.
Sure.
It's just very hard to do the procedure with an ultrasound.
Agreed.
There are other injections in the spine that you can perform ultrasound in.
Sure.
I just don't think discs is one of those.
Yeah, I agree. All right. So, lastly, congrats again on your new practice.
Thank you.
Where can people find more about what you're doing at BioEvolve? Obviously, San Diego's lucky to have you. How can they contact you or reach out to you?
Yeah. So our website is www.bioevolvesports.com, or you can email us at info@bioevolvesports.com as well.
Okay.
We are in Encinitas, which is North County of San Diego, but I see patients from all over the country and outside of the country as well. So feel free to contact us for any questions with regards to your sports injuries or musculoskeletal conditions.
All right, folks. Well, there you have it. I hope you enjoyed the biohacking of the spine. Thank you so much for doing this.
Thank you. I had fun. This was fun.
This was great. We'll see you next time.